I'm Professor Gerald Yonga, consultant cardiologist at Aga Khan Hospital, Kisumu. Every year we have what we call the Pacemaker Camp in this hospital. Pacemaker Camp basically is a surgical camp where we help needy patients who require a procedure called pacemaker implantation. A pacemaker is a gadget such as this one, which helps the heart to beat properly. Some patients end up having fainting attacks or sometimes even sudden death because the stimulatory system of the heart has failed. In certain situations, the heart rate can fall as low as 20 or 30 beats per minute, which does not allow the heart to maintain circulation. In that situation, the patient's life is at risk. And the only remedy we have for such patients is placement of a gadget called a pacemaker. The process usually takes about 45 minutes to 1 hour. The procedure is usually done under local anesthesia, which means that we only reduce pain around the left area of the shoulder where the gadget is usually put, and the patient is fully awake as this procedure is taking place. The patient usually wakes up from the table with a normal heart rhythm immediately and can go home the same day or sometimes just spend the night there for their own comfort. The healing takes about 2 weeks for the wound to heal, and the pacemaker continues to work on its own without any supervision whatsoever, with a battery life of average of 8 years. We do pacemaker programming after 6 months, and then after that there's an annual checkup just to make sure all is well. One of the major hurdles of people who require pacemaker is cost. The gadgets are fairly expensive and many people have no access to that kind of funding, especially if they are not insured. That is why once a year we hold this camp, and there are generous donations which usually come from well-wishers. The hospital also has something called welfare, and then we're able to help those who need this pacemaker and were not able to afford during the course of the year.
I was diagnosed for having a low pulse in 2022. I kept on going to the doctor, given drugs, which I was using every month. In the process of the treatment, he told me the only answer is to insert pacemaker. He told me the costs, which I found to be very expensive. I thought of having a second opinion. So my sister-in-law told me, okay, why don't you try Professor Yonga? So he booked me, I went there. He told me there is a donor. They are sponsoring a few needy patients. So my doctor recommended me. They booked me for an operation, which we did, led by Dr. Yonga, assisted by Dr. Chekwan and the team. So they did a fantastic job, inserted it and put me on the machine immediately. And definitely, I could see there is an improvement, and I became so happy that I have a lease of life.
I'm very happy today because the Khan people has helped us for something which we have been waiting for a period of time. Gotten that opportunity from the sponsors who has managed to put pacemaker for my mother who has been suffering from low heart rate.
Here I brought a patient by the name Nora Achola Odoyo, who happens to be my grandmother. And Nora was suffering from a cardiac condition 3 years. So we heard from a sponsor which was sponsoring pacemaker, which would also help to increase the heartbeat or improve that condition, since we were told there's no drug or medicine that would cure that condition. When we heard that there was a pacemaker camp at Aga Khan Hospital, we came very fast to make good use of the opportunity. Pacemaker was done for grandmother, and it was successful. Grandmother is now recovering and improving in terms of heart condition. I take this opportunity to thank the Aga Khan Hospital to have helped grandmother from this cardiac condition.
I was referred by my doctor. There's a program coming up at Aga Khan, and since the battery is so low, I should be given another one immediately. I came in, was prepared for an operation, and I'm happy to report that mine was done today successfully. And here I am, already discharged, and I'm about to go home.
Tunafurahi kwa sababu ya wakati huo ambao baba yetu ameweza kuhudumiwa Imekuwa ni safari mrefu kwa sababu hii ni mara yake ya 4 kuwekwa pacemaker, na kila wakati tumekuwa tukipata changamoto. Mara ya kwanza ilibidi auze shamba, mara ya pili akafanyiwa harambee, pia mara ya 3. Lakini wakati huu tunamshukuru Mwenyezi Mungu kwa sababu aliweza kutupatia hiyo fursa na akaweza kupata kuwekwa bila malipo yoyote.
We thank Dr. Yongo who connected us to the organization that agreed to do it for free, and Monica is now doing well, recovering from her operation. We also thank the Dr. Chepkwony with her team who did the operation, and it was very successful. Thank you so much, and may God bless you.